So we all know the dude. When he talks, he sounds like he's got a garbage disposal in his throat. I'm sorry, I shouldn't mock. Anyway, we all know that he is now over the Department of Health and Services, right? The dude with the brain worms who eats roadkill. Okay, just so we're all clear on who I'm talking.
So RFK has started gutting the Department of Health and Human Services. He is shutting down the Office of Infectious Disease, including the Office of AIDS Care and Policy. He's also shutting down the Office of Minority Health, and it'll be shuttered. 20,000 employees. This is the head of the health department cutting off care for people's health. Literally, the departments are in charge of solving and working on the AIDS epidemic, COVID, everything like that. And any minority health care are all going to be gutted and shut down. How does this help anybody? By closing the Department of Health and Human Services, 20,000 employees, no care for anybody or cures for anybody.
A new episode of Federal Workforce Fallout streaming right now on WUSA 9 Plus. It was a busy week as it relates specifically to the reduction of the federal workforce. One of the biggest things we saw was the reduction of staff at the Department of Health and Human Services. The Trump administration saying that it wants to reduce that department particularly by 20,000. 10,000 would be through buyouts, another 10,000 through terminations. Earlier this week, we saw a number of people waiting in line to get into the main campus to learn whether or not they still had a job. We'll talk about those cuts. We'll also talk about some of the mistakes that a career expert tells me that many applicants are making as they're looking for new jobs and to get back on their feet after these recent terminations, and whether or not AI makes sense if you are applying for a job right now. So be sure to check out Federal Workforce Fallout streaming right now on WUSA 9 Plus.
Are you dumb? He completely gutted the Department of Education recently. And when he gutted it, he announced that RFK Jr. is now going to oversee special education. A man who was addicted to heroin, who sounds like a LimeWire virus in your computer. The same man who thinks that vaccines are what's causing autism, even though there's been no proof to actually sustain that. The man who is concerned about radiation causing cancer in students instead of being worried about school shooters and making sure that kids have access to their phones in the event of emergencies like this. Same man who doesn't give a damn about school lunches being free and available to students in public education classrooms. I understand that everybody's very concerned about the type of quality of food that we get here in the United States, but if that's your only concern and what you're literally basing your entire narrative on, instead of focusing on the fact that there are children in this country who only eat at school, that the number one cause for underperforming students is food insecurity in school. So sorry, I'm no longer tolerating buffoons coming into my comment section trying to justify Donald Trump getting rid of the Department of Education and therefore impacting severely students with disabilities' ability to go to get a public free education. Y'all love to play dumb, which is exactly why we're in this mess.
A coalition of 23 states is suing the Trump administration over its decision to cut $11 billion in federal funds that go towards various public health programs. The lawsuit against the Department of Health and Human Services alleges that the cut was unlawful and will result in serious harm to public health. The suit also seeks to immediately halt the funding cuts. According to the AP, the funding being cut was allocated by Congress during the pandemic and was mostly used for COVID-related efforts like testing and vaccination. The money also went into addiction and mental health programs. In a statement from last week, when the decision was first announced, HHS said that it will, quote, no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago. However, the lawsuit claims that the rollback not only puts hundreds of jobs at risk, but also weakens efforts to stem infectious diseases like the flu and measles.
Hey there, everybody. So things continue to change on the daily. It appears that the Health and Human Services and their Secretary of Health and Human Services, Robert F. Kennedy Jr., has sent the email to all 80,000 HHS employees offering them a voluntary $25,000 buyout. So while I appreciate the approach that Robert F. Kennedy Jr. has taken in terms of trying to downsize the federal government, offering a reasonable buyout for employees to take, which is much, much better than the alternative, which we've seen from Elon Musk and Doge, where they just send out emails terminating people with no notice, giving them 15 minutes to clear their personal belongings out of their office. So this is a much more reasonable approach to downsizing the federal government. I believe back in the 90s, whenever President Bill Clinton worked directly with Congress over a 3-year period to downsize the government, that they too also offered a $25,000 buyout to federal employees at that time. So, but my position is this: how is this buyout going to possibly negatively affect Indian country? Why? Because the Indian Health Service falls directly under the Health and Human Services. So we in Indian country already know that there is always a shortage of doctors, nurses, pharmacists, dentists, optometrists, LPNs. The list goes on and on. Not to mention, IHS is already way underfunded than what any other healthcare agencies are. So if this buyout is also being offered to keep it personnel like doctors and dentists and optometrists and nurses and LPNs, that's going to have a dramatic effect on those tribes that are still directly serviced by the Indian Health Service. And I say directly serviced because we know that a lot of tribes have compacted with the federal government, where they have taken over the health services from the federal government. An example is Chickasaw Nation, Choctaw Nation here in Oklahoma, Cherokee Nation. A lot of tribes here in Oklahoma have 638 and have become what they call self-governance or compacted tribes. However, there's a lot of tribes, like my tribe, the Cheyenne and Arapaho tribes, I believe every tribe in western Oklahoma, that are still direct service tribes, where the federal government, Indian Health Service, runs the clinics for the Native people that are in those areas. So if this buyout is potentially offered to those individuals, it is going to negatively impact the amount of services and the level of services that are already hampered here in Indian country. I understand that a lot of other agencies around the country, not just here in Oklahoma, are also being negatively affected by the closing of the federal leases that many of these agencies currently have. I saw that list that came out the other day. I want to say there was 15 Indian Health Service facilities that are being targeted to be closed by Doge and Elon Musk. One of them is the Gallup Indian Hospital, which is a very large facility out there in New Mexico. So I'm not sure whether their senators there, their governor there, their congressmen are going to be advocating for to keep that facility open, as well as some of the other facilities around the country. I know up north in Minnesota, the senators there, Tina Stevens, Amy Klobuchar, are advocating to keep the Bemidji area office open, which I mentioned this the other day. But that area office services 3 big tribes right there in Minnesota, because they're still direct service tribes. And if you don't have people there to provide the services, particularly those, it's what's called residual services. It's services that tribes cannot contract from the federal government, because only the federal government can carry out those services. An example of some of those would be like the financial management, the contract services. So we've got to look at that. We've got to look at the impact that this is going to have. Again, is this a subtle way of trying to terminate the federal government's trust responsibility to Indian tribes? Again, like I said, I like the approach that Robert F. Kennedy Jr. has taken here. He's at least given the federal employees an opportunity to take a $25,000 buyout. Everybody knows that doctors, dentists, optometrists, nurses, LPNs that work for the federal government can make a lot more money in the private sector. A lot of them do it simply because they feel like they have a civil service or a civil duty to work for the federal government or public service. But if that offer is going to be made to them, I suspect that many of them are going to take it, because those individuals will have no problem finding jobs in the private sector. So I'll continue to keep everybody updated. If you like what you hear and see, give me a like and a follow. I'll continue to keep everybody updated. Ho ho.